Welcome to you from Chem Help ASAP. There are lots of ways that one might monitor the amount of drug in a patient. Let's see why drug concentration in the plasma is the standard. When we talk about plasma, we really need to start with blood. Blood, which is to say whole blood, is an extremely convenient tissue to sample. Sampling blood is not painless for the patient, but the level of discomfort is manageable for almost all patients. Any drug that is systemically administered, which includes all oral and injected drugs, circulates in the blood. So sampling blood is easy and allows collection of drug. Unfortunately, whole blood is not easy to analyze chemically. The cellular components in blood interfere in the analysis. Removing cells from whole blood through centrifugation yields the fluid fraction. The plasma. Plasma is much easier to analyze and therefore is a convenient fluid for detecting and monitoring drug levels in a patient. So the plasma concentration of a drug, CP, is convenient to determine. But is it informative or useful? In general, the drug target is not in the plasma, and it would be much more useful to know the drug concentration at the target. We'll call this value CT. Under the free drug hypothesis, the unbound concentration of the drug in the plasma, CPU, is the same as CT. We'll discuss this idea more on the next slide. Mathematically, if we know the plasma concentration of the drug, which we just said is convenient to determine, and the unbound fraction of the drug in the plasma, then we can determine the unbound plasma concentration. And therefore, based on the free drug hypothesis, the drug concentration at the target. Unbound fraction, or FU, is a bit more work to determine, but there are techniques for determining what fraction of a drug in the plasma is not bound to plasma proteins. Once we know the unbound concentration, we can compare the unbound concentration to the IC50 value of our compound on the target to determine whether the circulating concentration of the drug is likely to lead to a therapeutic effect in the patient. Therefore, CP is indeed a very useful value to monitor. Let's look at this differently. In the plasma, the drug will either be bound to plasma proteins or unbound. The total amount of drug is CP. Unbound drug is our unbound CP. The unbound drug is free to distribute throughout the body, including diffusing across membranes and entering cells. Let's assume our target is within a cell. The unbound drug can enter cells. At equilibrium, CT will be the same as CP unbound. Therefore, by measuring CP, we can infer the concentration of the drug at the target. Super useful. We've now given some reasons for monitoring plasma concentration of a drug, which is both convenient to monitor and relevant to the target concentration. Please like, subscribe, and/or leave a comment. Take care.